Your doctor just ordered a routine test. Sounds harmless, right? A simple screening, catch something early. Better safe than sorry. But what if I told you that after 70, that simple screening could be the most dangerous thing your doctor does to you, not because the test itself is harmful, but because of what happens next, the follow-up, the biopsy, the surgery, the complications, the recovery that your body at 7,075 or 80 may not survive. My name is Dr. Thomas. I've practiced internal medicine for over 25 years, and today I'm going to share with you the 5 medical checkups I would never recommend for my patients over 70. Not because these tests are bad, but because after a certain age, the math changes. And nobody tells you that. Before I go through the list, you need to understand one concept that changes everything. I call it the cascade effect. Here's how it works. A routine screening finds something. Maybe it's a spot on a scan, a slightly elevated number, a shadow on an image. Now your doctor has to investigate. That means more tests, maybe a biopsy. The biopsy finds something. Now you're talking about surgery or chemotherapy or radiation. Each step carries its own risks. Infection, bleeding, anesthesia, complications, hospital-acquired pneumonia, falls, delirium, cognitive decline that never fully reverses. And here's what most people don't realize after 70. Many of the conditions these screenings detect would never have caused symptoms in your lifetime. They would have stayed dormant. You would have lived your full life and never known they were there. That is the cascade effect, one simple test triggering a chain of interventions that does more harm than the condition ever would have. Now let me walk you through the 5 screenings. Checkup number 5, routine colonoscopy after 75. The U.S. Preventive Services Task Force explicitly recommends against routine colonoscopy screening. For adults over 75 who have been previously screened, yet millions of seniors over 75 are still getting them every year. Why is this dangerous? A colonoscopy requires full bowel preparation, which causes severe dehydration in older adults. The procedure itself carries a perforation risk of 1 in 1,000. That sounds small until you realize that a bowel perforation in a 78-year-old often means emergency surgery, ICU stays, and a mortality rate of 25 to 30%. The benefit, if you've been screened regularly and your previous colonoscopies were clean, the chance of developing a life-threatening colon cancer in the remaining years is extremely low. The risk-benefit ratio has flipped. What should you do instead? If you've had clean colonoscopies in the past, talk to your doctor about whether continued screening is actually necessary for you. Specifically, checkup number 4, aggressive cancer screening with PSA tests and mammography. I need to be careful here because this is where emotions run high. Cancer is terrifying, and the instinct to screen for it constantly feels like the right thing to do. But here's what the data shows. For men over 70, the PSA test has a false positive rate of nearly 80%. 8 out of 10 men who get a high PSA result do not have clinically significant cancer, but they get biopsied anyway. Prostate biopsies cause infections in up to 5% of cases. They cause urinary problems. They cause anxiety that lasts months. And for the cancers that are found, many are slow-growing tumors that would never cause symptoms in the patient's lifetime. Treating them with surgery or radiation causes incontinence, impotence, and a dramatic decline in quality of life. For women over 75, mammography screening detects cancers that have a very low probability of affecting life expectancy. The U.S. Preventive Services Task Force found insufficient evidence to recommend routine mammography after 75. The question to ask your doctor is this: if this test finds something, what would the treatment look like for someone my age? And is that treatment likely to extend my life or reduce my quality of life? Checkup number 3, Routine cardiac stress testing. Stress tests are ordered routinely for seniors, especially before surgeries. But a cardiac stress test in a patient with no symptoms is looking for trouble that may not exist. False positive rates in asymptomatic patients over 70 exceed 30%. A false positive means you now need a cardiac catheterization. That's an invasive procedure where a tube is threaded through your arteries to your heart. Complications include arterial damage, stroke, heart attack, and kidney damage from contrast. Die. If you have no chest pain, no shortness of breath, no dizziness, and no family history of sudden cardiac death, a routine stress test may create more problems than it prevents. The key question: am I having symptoms that suggest a heart problem? If the answer is no, ask why the test is being ordered. Checkup number 2, routine bone density scans, also called DEXA scans. Osteoporosis screening sounds benign, and for women in their 60s, it can be valuable. But for patients over 75, the results almost always show bone loss, because bone loss is a normal part of aging. The problem is, what happens after the diagnosis? You're prescribed bisphosphonates. These medications have been linked to esophageal damage, jaw necrosis, and a paradoxical increase in unusual fractures called atypical femur fractures. For many patients over 75, the medication side effects are more dangerous than the fractures they're trying to prevent. And the single best intervention for preventing falls and fractures isn't a medication at all. It's exercise, balance, training, removing trip hazards from your home, ensuring adequate vitamin D checkup. Number 1, carotid artery ultrasound screening. This is the one that concerns me most. A carotid ultrasound looks for blockages in the arteries that supply blood to your brain. It sounds critical, but in patients with no symptoms, this screening leads to one of the most dangerous cascades in medicine. A blockage is found. Now you're referred to a vascular surgeon. The surgeon recommends a carotid endarterectomy. That's a surgery to remove plaque from your carotid artery. In patients over 75, this surgery carries a stroke risk of 3 to 5%, the very thing you're trying to prevent. The surgery can cause the landmark. A CST trial found that in asymptomatic patients, the benefit of carotid surgery was negligible. In patients over 75, the surgical risks essentially canceled out any potential benefit. If you have no symptoms, no mini strokes, no dizziness, no vision changes, a carotid screening may lead you down a path that ends worse than where you started. Now, I don't want you to walk away from this video afraid of your doctor. That is not the point. The point is that you should be an informed patient. So here are the 4 questions every patient over 70 should ask before agreeing to any screening. Question: 1. What happens if I don't have this test? Question 2. If the test finds something, what would the treatment look like for someone my age and health status? Question 3. What are the risks of the follow-up procedures? Question 4. Is watchful waiting a reasonable alternative? These 4 questions will transform every medical conversation you have from this day forward, and I want to be clear about something important. If you have symptoms, if something has changed, if you're experiencing pain, bleeding, unexplained weight loss, new neurological symptoms, then testing is absolutely appropriate, regardless of age. Symptoms change everything. This video is about routine screening in the absence of symptoms. It's about the tests that are ordered because of your age, not because of your complaints. Your body at 70 is not the same as your body at 50. The medical system needs to respect that difference, and now you have the knowledge to make sure it does. If this information could help someone you care about, please share this video with them. Subscribe for more senior health content. And remember, the best medical decision is an informed one. I'm Dr. Thomas. Stay informed, stay healthy, and I'll see you in the next one.